Hello, and welcome to my presentation on implementation team planning. This presentation describes a quality improvement initiative to standardize behavioral health screening in a pediatric primary care setting using the Pediatric System Checklist, or the PSC-17. The goal is to implement universal tablet-based screening for children ages 5 to 17 with automatic scoring and integration into the electronic health record. The aim is to achieve consistent screening in at least 80% of eligible visits, improving early identification of behavioral health concerns. This project is currently in the pre-implementation phase. The implementation team structure includes the quality improvement lead, who oversees planning, staff training, workflow, development, and data review. The QI lead is brought in from the start with an emphasis on building relationships and co-designing the project to foster ownership and alignment. Pharmacy care providers review screening results, discuss findings with caregivers, document follow-up, and initiate referrals. Providers are approached one-on-one with messages tailored to highlight how the project benefits clinical care, streamlines workflow, and clarifies their responsibilities. The medical assistants and front office staff manage tablet distribution and send out emails, confirm screening completion, and coordinate check-in and workflows. These staff members are included via casual, personalized discussions that focus on how the new process will affect their daily work and ensure it's practical for them. In the information technology staff handle technical integration, scoring, automation, alerts, and reporting. IT staff are involved early in the process, participating in planning sessions to evaluate technical requirements and ensure smooth integration. Clinic leadership provides oversight, allocates resources, and reinforces accountability for sustainability. Leadership is kept informed through structured updates that connect the project to broader clinic objectives and priorities. Roles and responsibilities. Each team member has defined strategies and actions. The quality improvement lead uses PDSA guide implementation planning to design workflows, deliver training, and monitor data for clinic workflow and staff adaptation, starting pre-implementation and continuing throughout the project, resulting in a standardized screening process and sustained PSC-17 use. Primary care providers integrate clinical follow-up by reviewing the PSC-17 scores and discussing results with caregivers and patients ages 5 to 17 during eligible visits, with each visit as the dose, leading to early identification and appropriate follow-up of behavioral health concerns. Medical assistants facilitate workflow by distributing tablets and sending out pre-visit emails, confirming completion, and supporting rooming flow for caregivers at check-in, with each eligible visit as a dose, resulting in high screening completion and reduced provider burden. Front office staff coordinate patient flow by supporting tablet distribution and check-in, sequencing for check-in front desk operations, check-in with each eligible visit as the dose, ensuring minimal disruption in clinic flow. Information technology staff provide EHR integration support by configuring tablet to EHR upload, scoring alerts and report for EHR systems, data flow during pre-implementation, and troubleshooting as needed, resulting in accurate data capture for automated reporting. The data analyst monitors performance by extracting and reviewing HR data on completion rates and outcomes for project metrics and leadership monthly, with monthly reports as the dose, leading to data-driven refinements and progress towards the 80% goal. Clinic leadership offers organized structural support by allocating resources and reinforcing accountability for the implementation team pre- and post-implementation, with periodic engagement as a dose and readiness alignment with sustainability. This presentation details both relationship-based soft skills and objective engagement strategies for each team member. The QI lead demonstrates a high engagement level by building trust through transparent communication, validating staff concerns, and facilitating shared problem solving to promote psychological safety and engagement, assessing the CFIR-based readiness survey, and monitoring participation in the PDSA cycles, action completion. The pediatrician/general practitioner is engaged in a moderate high level using active listening, emphasizing clinical value and patient benefit, and acknowledging time pressure to reduce resistance with objective assessment through the PSC-17 completion rates and EHA follow-up documentation audits. The medical assistant and nursing staff show moderate engagement fostered by collaborative workflow discussions, role clarification, and recognition of frontline expertise, and is assessed via the CFIR readiness survey and tracking screening completion through the rooming process. Front office staff maintain moderate engagement through relationship building, early inclusion, reassurance about the workflow impact, and ongoing check-ins. This performance is assessed by the CFIR readiness survey and observation of tablet distribution and email consistencies. Implementation team engagement continued. IT staff, or information technology staff, is highly engaged through shared goals, clear expectations, and respect for technical expertise with objective assessment using system functionality checks and EHR data accuracy and uploaded reliability. The data analyst demonstrates moderate to high engagement by emphasizing their contribution to decision-making and outcome visibility, assessed by monthly EHR reporting accuracy and data timelines for the PDSA cycle. The clinic leadership is highly engaged through the alignment with organizational priorities, patient safety framing, and accountability discussions, with engagements measured by leadership, items on the CFIR survey, resource allocation, and decision follow-through. Thank you very much for looking at my presentation, and have a good day.